So let me invite Ms. Anu Acharya, the co-chair of South Chapter NATHEALTH, founder and chief executive officer of Map My Genome, also serves as a governing board member at CSIR. She's recognized as a young global leader by the World Economic Forum in 2011. I invite from the government Dr. V. Vinod Kumar, IAS Director of Medical Education, Government of Andhra Pradesh. May I request you, sir, to please grace the desk. And Ms. Anita Niranjan, the co-chair, South Chapter NATHEALTH, Director GHA Global Healthcare. This MoU, ladies and gentlemen, has already been signed between NATHEALTH and the government of Andhra Pradesh. NATHEALTH by Mr. Shravan Subramaniam, the President NATHEALTH, and with Dr. Vinod Kumar, the Director of Medical Education, Government of Andhra Pradesh. Herein, we are going to be more details about this MoU. We are going to be listening from the representatives here on the desk. And further, we'll have the exchange of the MoU. So with that, I request Ms. Anu Acharya for her welcome remarks for the session.
Thanks so much. Good morning, everyone, and I'm delighted that we have Dr. Vinod Kumar. He's a medical doctor from Bangalore, and he's also an IAS from the batch of 2015. So it's really nice to see somebody as, with the right kind of background to be able to head a very important division, which is the Division of Medical Education from the family and from the government of Andhra Pradesh. I think what is there in the MoU is very, very exciting because it shows a futuristic view of what Andhra Pradesh government is looking at in terms of not just looking at how do we actually increase the number of health workers and allied workers from an education point of view, but we are also looking at things that allow us to think about how the future is going to look like and how we can actually create plans to be able to work with the industry and not just look at emerging technologies that are out there, but also to be able to expand the diagnostic footprint and looking at preventive healthcare in a much bigger and broader way. And it is really nice to see that sort of an initiative because I think it sets the example for other state governments to be able to follow suit. And NATHEALTH is delighted, and thank you, Dr. Vinod, for signing this momentous MoU with the NATHEALTH this thing. And we hope that this will inspire others as well. And we are very excited to be working with that. So, can we now request you to give some welcome comments on? Yes, please. Yes, absolutely. Do you want to do it over there or?
Hello. Thank you for the kind introduction, Dr. Shravan Subramaniam ji, Ms. Anu ji, Ms. Anita ji, and all the delegates here. A very good morning to all the delegates and eminent industry leaders in healthcare present here. I'm pleased to have the opportunity today to speak and represent Government of Andhra Pradesh at this August gathering as part of this prestigious NATHEALTH Summit. It gives me immense pleasure and a great sense of satisfaction to showcase our state for its achievement in healthcare and opportunities Andhra Pradesh offers to various stakeholders and investors. Andhra Pradesh healthcare industry serves to the needs of more than 54 million people that reside in the country. It's a relatively newer state, wherein majority of the niche healthcare infrastructure has gone to the newly formed state. However, under the able leadership of our Honorable Chief Minister, Shri Y.S. Jaganmohan Reddy Garu, we are radically revamping the public health care, preventive health system, and curative care through strategic interventions. Healthcare sector is becoming one of largest sectors within the state, owing to the expanding coverage, comprehensive infrastructure revamp, deploying adequate healthcare professionals, adopting newer technologies, strengthening services, and increasing healthcare expenditure by public as well as private sector providers. Healthcare expenditure in state stands at whooping 7.3% of the state budget, which is one of the best in the Indian states. Several factors are driving the growth of the healthcare sectors in the state, which include aging population, growing middle class, rising lifestyle chronic diseases, embracing digital technologies, adopting AI, strengthening supply chain, penetration of health insurance, scope of PPPs, strategic services purchasing, emphasis on quality of care. AP is working on creating a transformational model of healthcare in the state, focused on four critical aspects: availability, accessibility, acceptability, and affordability, all aim towards achieving universal health coverage. AP has various advantages in utilization of healthcare services as it exhibits a better health seeking pattern. 14.2% of population reported themselves as ailing, which is second highest among Indian states. Higher demand for healthcare services and its utilization in state is significantly enhanced by affordability coming from Dr. YSR Arogyasri scheme, the oldest health insurance program in India, which at present covers over 85% of the population. And the national average is only 13.5% in rural and 12% in urban. Owing to availability and affordability of healthcare services, including good health-seeking behavior, coupled with consistent efforts of government right at the grassroots level, AP is much ahead of other states and national average in terms of vital health indicators. There is huge scope of private health sector in Andhra Pradesh. Private sector is an integral part in the healthcare service delivery in AP and is significantly adding to the efforts of public sector in terms of delivering healthcare services across the state. As per NSSO, private healthcare facilities in rural areas contribute to around 81% of spells of treated ailments compared to national average of 68%. Similarly, private institution accounted for 72% of the total inpatient admissions. For childbirths in AP continues to be among the top performers with 97% institutional deliveries, out of which total deliveries. Out of the total institutional births in AP, 50% happened in private sector. This testifies the demand, acceptability, utilization of private healthcare in AP. Demand-supply gap of healthcare infrastructure is also there in the state. A crude proxy of vulnerability of any health system is the availability, distribution, and financing of health services, including hospital beds and HR for health. India is estimated to have a total of 24,86,327 hospital beds. This is roughly 1.72 per thousand population. Within India, there is a huge disparity. The state is on its way to achieve the WHO norms. That is where there is role of private sector in Andhra Pradesh. AP public health system comprises of a network of 10,032 Dr. YSR health clinics, that is the subcenters, and 1,142 PHCs as a part of primary care, 177 CHCs, 53 area hospitals, 12 district hospitals as part of secondary care, and 16 medical colleges hospitals delivering higher secondary and tertiary care. Private sector comprised of total 5,189 healthcare facilities, which include 18 private medical colleges, having 58,239 hospital beds. Though there is decent availability of healthcare facility in the Andhra Pradesh, compared to many other states, still the current availability falls short of WHO norms, which is 3.5 beds per thousand population. Hence, there is a significant scope of new hospitals to come up in the state and cater to secondary, tertiary, also quaternary, and also research and development in health and medical science. To ensure adequate supply of hospital beds and to meet WHO norms, by creating additional 99,970 hospital beds, it requires whooping capital investment of 45,000 crore rupees in the state of Andhra Pradesh. Friends, the quality of healthcare system and services in a society is one of the crucial factors that reflects the standard of governance and is an important determinant of human development index. Government of Andhra Pradesh recognizes healthcare as a very important factor which determines the physical and mental well-being of the people. Lot of actions have been taken to ensure quality primary health care. We have Dr. YSR village health clinics. These health clinics are manned with one community health officer with BSc nursing qualification, one ANM, and 3 to 5 ASHA worker. These are being constructed for a population of 2,500 to 3,000. We have started family doctor program. AP government has introduced novel initiative of family doctor program to provide health services to rural population through dedicated doctor. It aims at strengthening the healthcare at the village secretariat level by bringing medical care close to the doorstep of the people. The services of family doctor are being provided by the medical officers of 1,142 PHCs through 10,032 village clinics. Every PHC with a population coverage of around 30,000 is being ensured with 2 medical officers. Here, we are emphasizing that the health-seeking behavior of the state is going to increase and nothing less. The family doctor and team shall be available from 9 a.m. to 4 p.m. and they provide following services: general OP, NCD management, ANC, PNC for pregnant women and children, Anganwadi visits, school visits, anemia monitoring, home visit to bedridden patient and palliative care, monitoring village sanitation in coordination with Panchayat Secretary. Non-communicable diseases survey is being taken up for the first time in the country. Keeping in view of increased disease burden of NCDs, Government of AP has taken an initiative to screen the population of NCDs in its entirety. AP is the first in the country to identify the importance of NCD's prevalence and initiated community-based survey, which means each and every Andhra person will get his NCD screening done as per the Government of India guidelines. The screened patients are also being generated with Ayushman Bharat Health Account IDs. The screened patients will now get a unique health ID. As on date, 75% of the total population or 92% of 30 plus population of Andhra Pradesh is already screened. NCDs along with generation of 3.75 crores ABA IDs have been already created in the state of Andhra Pradesh. That means each and every citizen will now see his or her data and documents about her health screening. Now she will start seeking for health. Now she will start looking for which private sector or government sector is going to provide what I need, which was hitherto not at all available. It is encouraging to inform you all that AP ranks second in terms of total population screened, first in terms of ABHA IDs created, first in terms of 30 plus age population screened. Additionally, the village level, the patients requiring further referral to higher facilities are facilitated under family doctor concept by duly referring them to the Arogyasri network hospitals. The admission of the referral case is further facilitated by Arogya Mitras who are appointed for every empaneled hospital under Arogyasri program. Thus, the primary as well as tertiary care is made possible at the village level under the family doctor program. The government has taken up a lot of steps to strengthen the secondary and tertiary healthcare. The government has strengthening programs for CHCs, area hospital, district hospitals, which are now standardized with the uniform staffing pattern. That means a CHC will have a promised services of 5 specialists. Area hospital in other parts of the country, it is called Taluka hospital or subdivisional hospital, will have a promised services of 9 specialties. District hospital will have a promised special services of 15 specialties. This staffing pattern, which is otherwise called HR restructuring, is done for the first time in that much detail in the country. It ensures equitable and equal distribution and availability of health services across its population. To mitigate the challenge of specialists in rural areas, the government of Andhra Pradesh has taken up many measures for attracting specialists, such as 50% additional pay over basic pay for specialists posted in tribal areas, higher remuneration for contractual doctors, and we have adopted zero vacancy policy. Means every hospital you go, there will definitely be a doctor, there will definitely be other professionals, in which include nursing, paramedical, and allied and other healthcare professionals. We have recruited 48,639 posts in the last 1.5 years. 3,899 specialist doctors, 2,088 medical officers, 5,777 staff nurses, over 13,500 ANMs, over 10,000 community health officers, over 10,000 paramedical staff, over 250 data entry operators, supporting staff are more than 3,000, which amounts to 48,693. We are strengthening the healthcare services under Nadu Nedu. We have launched a comprehensive program for revitalization of hospital and healthcare services across the state. The program aims to revamp the health facilities and give robust, decentralized, tertiary, and also public healthcare infrastructure in each district to provide accessible and affordable healthcare. The government has pumped in a whopping 16,855 crores for the infrastructure revamp. Nothing much to tell about Dr. YSR Arogyasri program, but for the benefit of all, this program covers over 85% of the population in the state, offering quality tertiary care free of cost. The program covers 3,255 procedures, which is more than the Ayushman Bharat and any other state's insurance program, in 2,250 plus network hospitals, which not only include Andhra Pradesh, but also includes hospitals in Bangalore, Chennai, and Hyderabad. The state incurs annual expenditure of 3,300 crores under this program. In addition to Arogyasri program, a sum of 225 rupees per day is also given as post-treatment sustenance allowance to the patients to compensate for the loss of livelihood during their recuperation period under the Arogyasri Asara program. Further, in addition to augment the tertiary care capacity in the state and to ensure geographical spread of these facilities, we have come up with the health hub policy, which will be of great interest to all the ladies and gentlemen over here. We want to encourage private sector operators to set up their facility in Andhra Pradesh. Under this policy, 16 health hubs across the state over a period of 3 years from 2021 onwards will be established. These health hubs would come up in 3 to 5 acres of land identified at the center of the district amongst the leading cause of death globally and also in India. 1 in 10 Indians have a risk of developing cancer during lifetime, and 1 in 15 has the probability of dying due to cancer. To tackle this menace in the state, Honorable Chief Minister has given us a roadmap that by 2030, every citizen shall have access to basic cancer treatment within 50-kilometer range, and no citizen of Andhra Pradesh should go out of Andhra Pradesh for advanced cancer treatment. We are already offering cancer care free of cost under Arogyasri without any ceiling on expenses in the network hospitals. Therefore, we would like to build a comprehensive cancer care ecosystem in Andhra Pradesh. Additionally, the state is working on building an ecosystem of medical equipment manufacturers in the state. Andhra Pradesh MedTech Zone, otherwise called AMTZ. which can create world-class products while making them economical as well for the state. We are in this age of health tech where AI, ML, and IoT startups are reinventing healthcare every single day. With the advent of minimally invasive therapies and robotic surgeries, we are stepping into a new era of healthcare. As a pioneer in IT and technology adoption, Andhra Pradesh will serve as a springboard for multiple collaborations in health ecosystem. I'm sure collaboration with NatHealth will bring in top-notch expertise for building capacities of healthcare staffs, use of technology in nursing, allied education, efficiency in public procurements, augmenting medical diagnostic capacity, and information network across the state, and effective use of data for designing health programs and health research in the state. We are looking forward to partner with you in realizing our Honorable CM's dream of making healthcare truly universal in letter and spirit. Thank you very much for giving this opportunity. Jai Hind.
Thank you, sir.
Thank you, sir, for sharing with us the various initiatives which the government of Andhra Pradesh is taking under the leadership of the Honorable Chief Minister in making healthcare and good quality healthcare more accessible and affordable to the citizens and ensuring the physical and the mental well-being of its citizens. Thank you, sir. And now we'll have the exchange of the MoU. I would like to request Anu Acharya and Anita Niranjan to kindly exchange the MoU with Mr. Vinod Kumar. As I mentioned, ladies and gentlemen, this MoU has already been signed between NatHealth So that is already been signed between Dr. Vinod Kumar and from Government of AP and between NATHEALTH, Mr. Shravan Subramaniam, President NatHealth. This MoU, ladies and gentlemen, is towards developing a comprehensive human resource augmentation plan at all levels, particularly the allied health workers and nurses, focusing on tech-enabled digital education and task shifting that allows the state to overcome HR supply constraints and be a net talent exporter outside Andhra Pradesh, bringing in supporting industry partners who can help scale this blueprint. Further, augment diagnostic capacity and information network across the state and develop data intelligence around preventive health, AMR, and other emerging health threats through data algorithms, collaborations, and research. Work closely with the Andhra Pradesh public procurement systems to transfer expertise on emerging global systems that are agile and track value per unit cost. Further, plan a health industry convention in Tirupati to showcase the healthcare efforts in Andhra Pradesh and ensure the presence of key decision makers across health ecosystem, and use this event to support other priority areas as envisaged under the MoU and mobilize the technical capacity and the participation of private sector. So thank you to the government of Andhra Pradesh. Thank you for this association with NatHealth. And I would now like to request Ms. Anita Niranjan, who's the co-chair of South Chapter, NatHealth and Director, GHA Global Healthcare Academy, who's been working on the win-win approach to bridge the gap between the academia and the industry, to kindly conclude the session with her concluding remarks.
Thank you. It's a real great pleasure to be here today. And thank you, NatHealth and the senior leadership of NatHealth. Dr. Vinod, it was a pleasure being here. And I'm sure this is a journey that has just begun and well begun. And we know that we have to make this extremely successful. Being from the neighboring state, I'm sure we all wanted to probably, be a best practice that all of us take home to other states as well. This MoU is surely a milestone for us, and I'm sure there are many more good initiatives that will come in our way. I was very, very happy to hear you talk about bringing about the family physician concept back. I think that was really, really nice. Looking at this new state coming up with initiatives like this, it says a lot that there's been a lot of groundwork that has happened, a lot of thought process that is behind, and it was really, really heartening to see the kind of efforts the government of Andhra Pradesh is putting forth. Capacity building, yes, I'm sure for last 2 days we've been hearing this, and I'm sure there are many initiatives each one of us know that we need to take as part of us and build capacity, which is really, really the need of the hour. And the previous session especially focused on allied healthcare and other paramedic people that we need in our industry. I also take this great opportunity to let the people here know about the event that Andhra Pradesh government would like to host in Tirupati, and inviting all our industry colleagues to be part of it. I'm sure that's going to be fantastic, because we are looking at not only healthcare, hospitals to be on board, but also technologies and AI related products to be there. That's going to be a great another initiative, and we really, really look forward to that event, and that's going to be in Tirupati. Data management you spoke about, again, is the need of the hour, and it's very heartening to know that you have been, kind of taking leadership here and being the, in terms of screening, you've been probably in the first 2 or 3 in the ranking in among other states. So it's really, really good, and I sincerely thank you for being here. Thank you for kind of trusting NatHealth with this initiative. And on behalf of the leadership of NatHealth and the members, I sincerely thank you. And thank you, Anu, for being with us here on this dais and taking this forward. So look forward for a journey which is going to be extremely important for all of us. Thank you so much. Thank you, everyone.
Thank you. So further celebrating this association and expressing deep thanks to the government of Andhra Pradesh, I would like to request Ms. Anita to kindly present a bouquet to Dr. Vinod Kumar.
Yeah.
Thank you. So we're sure this association will further flourish, and we are going to be contributing towards making healthcare more accessible, affordable, and taking it to the doorsteps of the people. Ladies and gentlemen, we're now going to be moving into the next session. That's the presentation of the awards, which we're going to be seeing at the hands of our Honorable Chief Guest, the Honorable Minister of State for Corporate Affairs, and also the Minister of State for Planning and Program Implementation and Statistics, Shri Rao Inderjeet Singh. He's going to be joining us about 12:15. So would like to request you all to remain at your respective seats. We'll just a little bit of settling the stage towards the award ceremony. We're also going to be joined by Mr. C.K. Mishra. He's the former Secretary Health and the former Secretary Ministry of Environment, Forest and Climate Change. He's the jury chairman of the awards. We received almost 63 nominations, and then judging through them and finally selecting the winners who are going to be recognized today he's leading the jury. So we are going to be hearing also from him the various criteria, the process, the evaluation process which has been done. Also, there was a campaign, Win with Vaccine campaign, which was launched by NatHealth. So more about the campaign, we are going to be introducing and talking about it during the session. and then, of course, the presentation of the awards and inviting the address of our Honorable Minister. So that's going to be the session which is going to be following. But let me thank all our sponsors who have contributed towards the success of these 2 days Arogya Bharat 2023. A big thank you to our platinum sponsors, Krishna Diagnostics, to O3 Capital, Fortis Healthcare, who are our gold sponsors, Wipro G Healthcare Private Limited, to Rumo, thanking IQVIA, also Vigon SAS, our silver sponsors, Vocard Hospitals, Polymedicure Limited, Metropolis Healthcare, Indus Health Plus. Thank you to Siemens. Thank you to GenWorks Health Private Limited, to Marengo Asia Healthcare, Dr. Lal Path Labs, to Apollo Hospitals, to Neothea Get Well. They have been our session sponsors. Bharat Serums and Vaccines Limited, MGM Healthcare, Dialysis Services Providers Association of India, ProTribe Services India Private Limited, Metro Group of Hospitals, and Roche Holding AG. All our sponsors, also our knowledge partners. As you saw that in these 2 days, there have been various white papers, knowledge papers, which have been released. These have been very detailed, comprehensive studies which have been undertaken by NatHealth along with their knowledge partners. We would like to thank our knowledge partners, Arthur D. Little, Boston Consulting Group, Center for Knowledge and Development, AV&V, IA Meetings, Health Biz Insights, Lattice One, PwC, TIE Mumbai, ENY, and Whitespace. Ladies and gentlemen, just after the award ceremony, we are going to be then moving into the lunch break, and post lunch we have another session, the patient safety session. So with that, we are going to be ending our thought leadership sessions. But yes, we have the Startup Hub, the Innovation Hub, which is in the Regency 4 and 5. That's in the basement, where we have the technology innovators and influencers showcasing the latest state-of-the-art technology. There is an interface with the startups, the new startups in the healthcare sector. It's an opportunity for them also to showcase their technologies, their products, their systems, their innovative ideas and thoughts, share it with the industry, further more being enhanced by their contribution. And further to it, we then have also yesterday, as we saw, that apart from the addresses from our presenters, we took the dialogue and the discussions on the studies which have been done, especially on the dialysis, on health financing, how to take and how to accelerate the progress of universal health coverage, taking it to the last citizen. We've covered in just the previous session, we covered allied healthcare. We had Dr. Alok Kumar, who's now with the government of Uttar Pradesh, and earlier was with Niti Aayog. He shared with us the challenges which are there, especially not just in he mentioned that we can ensure the demand, but then the supply, but then the demand part is something which we need to work on. Skilling them, upskilling them, addressing the wage disparity which we see, and giving them an opportunity. So that is where, again, the industry and the academia have to work together. So all these insights and very valuable and constructive recommendations which have been shared by our industry speakers, by the academicians. We had Mr. Yaravedkar, Professor Yaravedkar from Symbiosis. He mentioned about the academia taking initiatives towards that. But then we need, as was mentioned yesterday also, instead of working in silos, we need to integrate all these efforts which are being taken by various heads, and that is going to be promising a more holistic growth of the industry, of the sector, and contributing and working also closely with the policymakers, with the government, and towards ensuring that, yes, good quality healthcare is made affordable and accessible to every citizen of this country. That is where the public sector, the private sector, government, all stakeholders have a very contributing role towards this. I think I'll call, we have some time in hand. We've been having these quiz rounds where we've had RJ Ria taking it, and as you answer the questions, also this is a poll basically analyzing and assessing from you what is your thoughts on certain questions which are shared here. And towards that, then we have the goodie bags and the gifts extended. Okay, just to inform you, we have running tea and coffee outside, but I think I'll call people who are interested in having tea. You may grab a cup of tea and join us back. Meanwhile, we'll... So the information which we have, the Honorable Minister is going to be joining us in another 5 minutes, requesting you to remain at your seats only. I call Ria. So we'll have the Honorable Minister joining us shortly. And ladies and gentlemen, these are the Healthcare CSR Awards, felicitating the corporation, CSR, and other philanthropic organizations in the field who are contributing to the well-being of the people and to that of the nation at large. Our knowledge partner for this session is CKD, thanking them.